So the other option is a custom cheek implant. Now, a custom implant is made specifically for your face, your skeleton, and with the exact proportion and dimensions that you want. So here's an example of a custom cheek implant. Now, this patient decided on custom cheek implants for a couple different reasons. His goal is to have more definition, strong, structured cheeks, as well as a more strong, defined jawline, which also doing a custom jaw implant as well. But the goal for the cheeks was to have pronounced cheekbones, but he had also lost a lot of weight recently, and so this part of his face, the fleshy part of the cheeks, had also decreased in volume and needed some more volume under the eye. So there is not an implant that combines the tear trough, the malar implant, and the submalar implant. In this implant that we designed, it basically combines all three of those, but with the custom implant, I was able to design a lot of structure in the malar area, restore some volume here in the submalar area, fill this out a little bit, but I did not have it descend so far that it would look feminizing or give him round kind of Kardashian cheeks. We're just trying to replace the volume here, but be extra in the cheekbones. And this is a time when a custom implant is really the best because there is no implant that does all three of these things and does one a lot and then another just a little bit. So custom implant is a great choice here. And here's another example of a patient who did custom chin implants. I'd previously done standard off-the-shelf jaw and chin implant, which worked great in this case, but he decided to do custom cheek implants because his needs for his cheeks didn't quite fit any of the implants available. So in this case, the goal was to give more structure to the cheekbones and add more volume, but really had a lot of kind of just depression and hollowness here around the eyes. And so what I was able to do with a custom implant is build up the volume higher than any off-the-shelf implant comes. And then we were able to extend that volume across the tear trough to add a little bit more structure and support there. Also, the two sides of his face were a little bit asymmetric, and so one implant actually is bigger than the other so that externally all of the measurements are equal and symmetric. So this is another great example of when a custom implant is probably better than an off-the-shelf or standard implant. So not everybody needs a custom implant. For some people it's preferred, it's what they want, but in a consult I'm usually able to talk to patients and see what exactly their goals are and help steer them one way or another.